RealAgriculture.com's coverage of Cropweek in Saskatoon is brought to you by FarmLink Marketing Solutions, BioVision Seed Labs, the Canadian Wheat Board, and High Stick NT. We're joined right now on RealAgriculture.com by Faye Dokken Bouchard. Welcome today, Faye.
Thank you.
Faye, when you look at some of the analysis, what are some of the disease issues in lentils that you might be concerned about going into this season?
Well, going into 2011, we have to look at what we experienced in 2010 because that will determine what types of disease inoculum we may have available. And we saw last year in over half of the crops that were surveyed in the southwest parts of Saskatchewan and west central parts of Saskatchewan that we saw stem phyllium blight being the most common disease, sclerotinia and botrytis being right up there and probably the most talked about disease in 2010, causing those moldy lentils. And as well, we saw anthracnose and ascophyta blight that we probably haven't seen as much of in the last few years, and we've got some good resistance developing in lentil varieties, but under the conditions that we had last year, there was just a lot of disease pressure and a lot of diseased lentil fields out there.
So would the concern into 11, would the concern around those diseases be heightened?
The concern about the inoculum levels will be heightened for those diseases. However, we have to remember that ultimately it will be the weather that will determine whether or not we get a lot of disease or not. Okay. Because last year we may have not had a concern about those diseases going into 2010 as we hadn't had a high level of any of those diseases in the last couple of years where conditions were a bit more dry in those parts of the province where we grow a lot of lentils. But it was the weather that really determined how much disease we had last year, and we had a lot of disease. So if we have a dry year next year, then we could probably expect that we won't have as much of any of those diseases, but there will be increased inoculum levels as a result of the disease. So all of the crop residue, the lentil residue out there will likely have those diseases surviving on it. And as well as some other crops like sclerotinia, it'll be canola residue and pea residue and chickpea residue will all have sclerotinia.
So is there anything that producers can do to try to, I guess, best management practice, sort of try to minimize the impact potentially if it is a wet year?
Yeah.
Which the Drew Learner's kind of forecasting?
Right. If we are pretty sure of that wet year, I guess, for next year, then crop rotation will be really important. And I know that can be really difficult because there's a lot of things that go into that decision, and a lot of it is economics. But the thing to remember is that if you are pretty sure you're going to have disease, then you have to think about what host you're putting in there. So that's just the other side of that disease triangle. So we have the disease inoculum levels, we have the weather conditions, and then it'll just be determined what host. So some of those diseases are host specific. So if you had a lentil disease problem in one field, you want to avoid lentils in that field for a few years. And as well, if sclerotinia was an issue, again, it's really difficult because there's a lot of crops that are susceptible to it. But if you had a big sclerotinia problem in a particular field, you want to rotate away from those crops for next year.
But obviously, with lentils being a pretty profitable crop in Saskatchewan right now, it's hard to move away from lentils. Yeah,
it's hard to move away from lentils. But if you have any fields that haven't had lentils, especially last year, but in the last few years if possible, then that is an ideal location for a lentil crop for next year. So it's taking a look at your rotation in the past 2 years and planning out where you want your rotation to go in the next few years as well. So it has to be a long-term thing, not just saying, well, what did I grow last year, what will I grow next year, but maybe looking at the last few years and how much disease you had in those fields, and then the next few years going from there.
Faye, thanks a lot and good luck with the rest of the show.
Thank you very much.